Hello, today is April 30th, 2023. My name is Jennifer, and I am a student of Professor Ruggieri's English 1010 class, and I am presenting my final research project. So I decided to do my final research project on the United States maternal mortality crisis. So what is maternal mortality? Maternal mortality, defined by the World Health Organization, as a death of a woman while pregnant or within 42 days of termination of the pregnancy from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Maternal mortality rates are the number of maternal deaths per 100,000 live births. In 2021, the U.S. maternal mortality rate shows 1,205 women died of maternal causes compared to 861 in 2020 and 754 in 2019. The maternal mortality rate for 2021 was 32.9 deaths per 100,000 live births, compared with a rate of 23.8 in 2020 and 20.1 in 2019. The maternal mortality rate for non-Hispanic Black women is substantially higher compared to the rates of white and Hispanic women. In 2021, the maternal mortality rate among non-Hispanic Black women was 69.9 deaths per 100,000 live births. That is 2.6 times the rate for non-Hispanic white women. Maternal mortality rates increase also with maternal age. So in 2021, rates of women under the age of 25 was 20.4 deaths per 100,000 live births. For women ages 25 to 39, 31.3 deaths per 100,000 live births, and women ages 40 and over were 6 times higher than the women under age 25, showing 138.5 deaths per 100,000 live births. Comparing the rates from 2020 and 2021 in the same age groups shows a significant increase. So why have the rates been increasing? There are several reasons that impact maternal mortality. Most complications happen during pregnancy and are preventable or treatable. Other complications may be pre-existent, but worsen during the pregnancy, especially if not managed as part of the overall care of the woman. The complications that account for 75% of all maternal deaths are severe bleeding, mostly after childbirth, infections, usually after childbirth, preeclampsia, which is a condition in pregnancy characterized by high blood pressure, sometimes with fluid retention and proteinuria, which is high levels of protein in the urine that is being secreted from the kidneys, and eclampsia, which is a condition in which one or more convulsions occur in a pregnant woman who suffer high blood pressure. It is often followed by coma and poses a threat to the health of the mother and the baby. So what can be done to prevent maternal mortality? With increasing prevalence of chronic health conditions in women of childbearing ages, developing standard protocols may help improve outcomes in this population. For instance, implementing a policy to dispense antihypertensive medications for patients who exceed the recommended blood pressure during pregnancy can significantly reduce the incidence of maternal mortality rate due to preeclampsia and eclampsia. However, addressing this pre-existing medical condition at the time of delivery is unlikely to prevent severe maternal mortality. Maternal mortality review committees often report that most women who died during pregnancy or shortly after lacked proper care of management of chronic health conditions prior to their pregnancy. So how can women access better prenatal health care? Health insurance for new mothers is critical to help support access to postpartum care and overall care for their family. Postpartum uninsurance has adverse health and financial consequences and negatively impacts new mothers. and may also be contributing to maternal mortality. This is particularly true among non-Hispanic Black women who have the highest pregnancy-related deaths in the United States and the largest proportion of pregnancy-related deaths after 42 days postpartum. Some states have extended Medicaid eligibility to low-income pregnant women, but they often lose coverage just after 60 days after delivery. Before implementation of the Affordable Care Act, 55% of women who were covered by Medicaid at delivery experienced uninsurance during the following 6 months. Legislators at state and federal levels have introduced a policy that extends Medicaid coverage from 60 days to 1 year postpartum to address maternal mortality. Proposed legislation to extend pregnancy-related Medicaid coverage could reduce uninsurance and coverage gaps among new mothers. A survey from the American Community data from 2010 to 2017 shows despite coverage gains, nearly 500,000 new mothers remained uninsured. So what can we do to decrease maternal mortality rates? First of all, women must have access to affordable health coverage. Uninsured new mothers are less likely to go for their follow-up postpartum appointments because of their fear of financial medical debt. Second, access to affordable health coverage. Access to affordable health care to manage chronic health conditions will help decrease maternal mortality rates, such as hypertension, high blood pressure, and the importance of treatment with a hypertensive. Third, preventing hemorrhaging and infections in a hospital setting. Severe bleeding may occur after birth and can kill a completely healthy woman in just a few hours if left unattended. Injecting oxytocin, which is a drug that helps prevent or controls postpartum or post-abortive hemorrhaging, immediately after childbirth effectively reduces the risk of bleeding. Preeclampsia should be detected in an appropriate amount of time before the onset of convulsions, eclampsia, and other life-threatening complications. Administering magnesium sulfate for preeclampsia can lower the risk of developing eclampsia. Infections after childbirth can be significantly reduced if practicing good hygiene, and detecting early signs of infections in a timely manner and treating them accordingly is crucial. So how can women benefit from midwifery? Midwives are healthcare professionals who provide an array of healthcare services for women, including exams, contraceptive management, prescriptions, and labor and delivery care. They provide care during labor and delivery and postpartum. Midwives must receive training and pass an examination to become certified. Midwives provide quality and economical care. They usually offer a payment plan and offer sliding fees. They also take most insurances, including Medicaid. According to the American College of Nursing Midwives, benefits of midwifery include decrease in cesareans, reduced labor-induced in augmentation rates, reduction in anesthesia use, decreased infant mortality rate, decreased preterm birth, decreased stage 4 perineal tears, lowers costs for the client, and satisfaction with quality of care. If all of these things were implemented, it could drastically decrease maternal mortality crisis America is facing. I hope this information was useful. I'm going to provide some graphs as well that you can view to see where I got my information from. But I think this is something that should be taken quite seriously going forward. Have a great rest of your Sunday and take care of yourself. Bye-bye.